Dr. Ivan Meiszinger not only works with families living with Down syndrome, he also has personal experience supporting his brother. His advice to parents and caregivers: let them try and fail and learn. What is Down syndrome, Dr. Meiszinger? It's a genetic condition where an individual inherits extra genetic material from their mom or dad. And most common in Down syndrome, it's an entire extra chromosome. The medical name for Down syndrome is trisomy 21. What are the risk factors that may impact someone having a child with Down syndrome, Dr. M? There are different thoughts on different risk factors, but the main one that's been shown is advanced maternal age where the mother is over 35. In saying that, the majority of people who are born with Down syndrome are born to women less than age 35. How is Down syndrome diagnosed in pregnancy? Through screening. In modern medicine, we're taught to offer screening to every pregnant woman who walks through our door. The first one is the first trimester screening, which uses a combination of blood levels, as well as measurements from an ultrasound to come up with the chance that your baby has Down syndrome, or some other genetic abnormality. What is the impact of Down syndrome on a child's development? Just like the neurotypical child, there are going to be huge variations. But you can be more certain that there will be developmental delay to some degree. The 5 developmental domains are gross motor, fine motor, language, social and cognitive. Are people with Down syndrome at a higher risk for other health conditions, Dr. M? They can be. For example, thyroid abnormalities is one to be aware of and something you'd want to get treated. Another common one in the long term is Alzheimer's disease. At 50 years of age, about 30% of people with Down syndrome have early signs of Alzheimer's. How can parents best manage raising a child with Down syndrome, Dr. M? Reaching out to communities, especially in city settings where there are communities of individuals and families that are ready to offer help and mentorship. A phone call to the Canadian Down Syndrome Society would provide a world of resources. What's changed over the years for people living with Down syndrome and their caregivers, Dr. M? If you look at the average life expectancy of someone with Down syndrome in the 1960s, it was around 10 to 12 years of age. Now we're at around 60 years of age, and the thought is that someone born with Down syndrome right now would live close to a neurotypical life expectancy, like 80 plus. What's one piece of advice you would offer a parent of a child with Down syndrome, Dr. M? They have capability. We really do a disservice to their abilities by doing everything for them or not allowing them to try and fail and learn. Having them try and fail and learn from it is a way of helping them learn how to work through a challenge and how to persevere. If you enjoyed this video, share, like, and subscribe to our channel. For more information and resources to manage your healthcare journey, visit healthing.ca.